Hello everyone. Today we are going to discuss an important condition seen commonly in pregnancy and postpartum women called diastasis recti. As future nurses, it is important for you to identify, educate and support patients with these conditions. I am Rima Stanley, lecturer at M College of Nursing. Objectives. By the end of this session, you will be able to define diastasis recti, understand its indication, identify symptoms and risk factors, learn how to assess it, and know its management. Let us begin. First, let us understand the anatomy. The rectus abdominis muscles, also known as the six pack muscles, run along the front of the abdomen. During pregnancy, these muscles stretch and separate due to the growing uterus. Diastasis recti is a common but temporary condition affecting up to 100% of women in late pregnancy, involving the separation of the rectus abdominis muscle, which is called as the six pack muscles, along the midline tissue, the linea alba. It causes a belly pouch, core weakness, back pain, and potential incontinence. Treatment typically involves specialized physiotherapy to strengthen the core, with surgery being the last resort. What is diastasis recti? Diastasis recti refers to the separation of the rectus abdominis muscles. It usually occurs during and after pregnancy due to increased pressure on the abdominal wall. Now, why does it happen? This happens because the growing uterus stretches the abdominal muscles. Hormonal changes soften the connective tissues, and increased abdominal pressure weakens muscle support. So, it is a natural but sometimes problematic condition. Who gets it? Diastasis recti is most common in pregnant women, postpartum mothers. However, it can also occur in others with increased abdominal pressure. How common it is? It is quite common. Around 60% of women experience it during pregnancy, and about 40% still have it after 6 months postpartum. So, it is something nurses will frequently encounter. Now, what are the symptoms? These symptoms can be visible and functional. Diastasis usually develops in the first third trimester. You may not notice the sign of diastasis recti until several weeks after your baby is born. Common symptoms include a visible bulge or a pouch in the abdomen. Even after losing any weight you may have gained during pregnancy. Soft or jelly like feeling near the belly button. Conning or dooming when contract the ab muscles or lean back in a chair. Difficulty in doing daily activities like lifting heavy objects, walking, etc., and pain during sexual activity. These symptoms affect both physical comfort and confidence. Additionally, the symptoms include low back pain, pelvic or hip pain, poor posture, urinary leakage while coughing or sneezing, constipation, weak abdominal muscles. These symptoms can affect quality of life. Now let us see the risk factor. Important risk factors include multiple pregnancies, such as having fewer than 12 months between pregnancies, age above 35 years, and having multiples such as twins or triplet pregnancies, having a heavy or big baby, and being extremely petite, that is, small body frame, and vaginal delivery with excessive pushing. This increases the strain on abdominal muscles. Now, how do we assess? This is a self test method and it can be done by, first of all, lie on the back with knees bent and feet flat on the floor. Lift the shoulders slightly off the ground, keeping one hand behind the head for support, almost like doing a sit up. Look down at the belly. Then move the other hand above the belly button area, palms down and fingers towards the toes. Use fingers to feel for a gap between the abs. See how many fingers can fit in the gap between the right and the left abdominal. If the gap is 2 or more fingers width, it indicates diastasis recti. How it can be fixed or managed, this is mainly done through lifestyle modification. Diastasis recti can often improve on its own within 3 to 6 months after childbirth, but if it does not, a physical therapy is recommended. Certain movements will make abdominal separation worse. Here are some modifications one should make in the first 6 weeks postpartum. First of all is to avoid lifting anything heavier than the baby's weight. Roll onto one side when getting out of bed or sitting up. Use arms to push oneself up. Skip activities and movements that pushes abdomen outward like crunches and sit-ups. You may also advise women to wear an elastic belly band to help hold belly in and support lower back. Wearing binders cannot heal diastasis recti and won't strengthen the core muscles, but they can be a helpful reminder to engage core and use good posture. And it is never too late to repair diastasis recti. With proper exercises, one can fix ab separation years after a woman have delivered their last baby. This helps prevent worsening of the condition. Exercise play a key role. Focus on deep breathing exercises, use slow and controlled movements. And one should remember to avoid activities such as crunches and sit-ups, planks without modification, certain yoga and pilates movement. Improper exercises can worsen the condition. Now, to prevent diastasis recti, it is important to maintain healthy weight gain during pregnancy and practice good posture. Do safe core exercise, avoid straining, and use proper techniques for movements. Prevention is always better than treatment. Complications. If a person has severe diastasis recti and if not managed properly, complication can include umbilical hernia, increased back pain, urinary incontinence, pelvic pain, pain during intercourse. So early identification is important. Keynotes. Diastasis recti is separation of abdominal muscles and common in pregnancy and postpartum. Surgery is usually very rare. Proper exercise and lifestyle changes are most effective. Diastasis recti is common but manageable. So, as nurses, your role is to educate mothers, identify early symptoms, guide safe exercises. Proper care and awareness can greatly improve recovery. Reference. Thank you for watching this video.